Welcome everyone to this video podcast. My name is Laura Molgaard and I'm the Interim Dean at the College of Veterinary Medicine at the University of Minnesota. So I'm excited today to have with me one of our alums, Dr. Heather Case. Heather is a graduate of the University of Minnesota from the class of 1998 and also a graduate of our Masters of Public Health program. She is now the CEO of the International Council of Veterinary Assessment, the group that organizes the NAVLE, and is a wonderful member of our Alumni and Friends Society Association. So welcome, Heather.
Thank you so much, Dean Molgaard. It's absolutely my pleasure to be here with you today.
So I'll start with a question for you. You're right in the thick of things. What are you hearing about the class of 2020 in their preparedness so far in this challenging time of the pandemic?
I mean, I think that ultimately it's that we're all in this together. That's the message that veterinary medicine has certainly been conveying since early March when we all faced this unprecedented pandemic. There's a couple things, one, we've been recognized as a profession as an essential service, and that has certainly helped, from the perspective of us being able to continue testing our graduate veterinarians and our students on the NAVLE. But at the end of the day, whether it's the regulators or the assessors, such as ICVA, AAVMC, certainly, your dean's organization, is that we're all wanting, as you've mentioned, to provide a quality, qualified, competent, and prepared veterinarian. And I am confident that, as a proud alumni, that the University of Minnesota is working to accomplish this. And so with that, I have a question for you, actually, and I'm just wondering, Dean Molgaard, if you can share with me, what is it that Minnesota has been doing during these unprecedented times to ensure that the fourth years, the seniors, are having experiences that are leading them to be ready at that day one when they graduate from the University of Minnesota?
Yeah, thanks. I mean, as you said, we are all in this together, absolutely. And I'm on regular calls with the other deans from around the world, actually, to hear how people are adjusting to this hand that we've been dealt. So I'm really proud at Minnesota that we've had a fairly flexible approach. The university has a campus public health officer that handles the exception requests. And so we've been able to use that process to keep students in clinical experiences, even when the rest of the university had to pivot to online only in March. We were able to keep a select few of our class of 2020 who needed those remaining core experiences. We were able to keep them going to ensure that they would graduate on time. And then we've been using the same process for the class of 2021 to continue to increase the in-person experiences that they're having. Some of the clinical instruction has pivoted to more of a virtual instruction or online delivery. And while that has been a lot of work for the faculty, they've really risen to that occasion and used a lot of creativity. I think one of the benefits to students in that is that it has forced us to take a step back and think about how do we best achieve our learning objectives. And so it will never substitute for hands-on. We definitely are providing the hands-on experiences to complement that instruction, but that's an example of kind of a silver lining, I think, that it forced us to sort of step back and think about what's the best way to ensure that students and the outcome have these competencies that we need them to have.
That's great. And you're right, there are definitely some silver linings, I think, that we're experiencing. But what about the first and second and third year students? And what's the college doing to ensure that they have an appropriate experience?
Yeah. Well, first I want to acknowledge that it is not the experience that students thought they were signing up for. And so we are balancing empathy for their frustration that the world is, at least for now, changed, with assuring them that it is our absolute obligation to make sure that they have a very high quality education. And so again, it's the creativity and tremendous hard work of our faculty and staff to find new ways of doing things. So last March, we needed to pivot to online only instruction for year 1 through year 3 students. And that was, I mean, we had basically a weekend to do that. We didn't have a lot of prep time. But since then, we've been able to invest much more time in thinking from an instructional design point of view about what can be done virtually versus what needs to be done in person. And through that process over the summer, we've designed a hybrid curriculum. So our year 1 through 3 students are in a hybrid curriculum where anything that can be offered remotely happens remotely, so that we can save that time during the day for students to do the hands-on experiences. And so for that, what we've done is we've developed a system that we're calling pods. So we have our students in much smaller groups for their lab and clinical experiences than we would have done before the pandemic, another maybe silver lining. And those pods kind of become a family group. So they're together consistently from class to class throughout the full semester, so that we aren't having that sort of intermixing of students. And those pods have been designed very intentionally to try to put students together who would have been together anyway. So for example, roommates, etc. And then you know a little bit about our pod system because you're one of the pod, do we call them pod parents or pod mentors?
I like parent. I think they're something like a mentor, but yeah, I'm thrilled to be one of those.
Yeah, so you know that they have very creative names. I know there's a manatee group, and what's your group called?
Yeah, so our group is called the Narwhals,
The
and
narwhals.
yeah, I really got to commend, again, I'm biased because I'm a proud alum, but I really have to commend the University of Minnesota for that idea. I think it's quite unique across veterinary schools, what you're doing there, and it just seems so
Yeah.
valuable.
Yeah, I'm not sure, 100% sure if other schools are doing this or not, but I was really proud of Dr. Erin Malone for leading this effort and for working with some of our epidemiology and other public health faculty to think about what are the strategies that we can use above and beyond the regular strategies, of course, of requiring mask use and social distancing and hand washing, et cetera. But what are the other strategies we can use to minimize risk and maximize benefit? So through that strategy, we've got these small groups of students moving through their hands-on experiences while getting all of what used to be in a lecture format in more of a kind of flipped classroom fashion. And we will continue to evaluate what's working well and keep doing that, and what needs to be tweaked and tweak that. That's an approach that we've really always taken at Minnesota.
Absolutely. I can speak from having experienced it as a student that has always been the case at Minnesota. Last question that I have for you, are there any changes coming from COVID and from all these pivots that the University of Minnesota has had to do that you believe, we talked a little bit about that silver lining, that you believe will continue in the post-COVID era once we finally attain that?
Yeah. If we as higher education in general don't take advantage of this crisis to learn from it and figure out what should be carried forward, we will have really missed an opportunity. Again, we are all in this together, and we wouldn't have signed up for this kind of adventure, but through this process, I really believe that there are going to be some things that we will want to carry forward, things that are more efficient, things that are more effective. We, as I mentioned a little bit earlier, by stepping back and being honestly forced to redesign things so quickly, we have to think about what's the end in mind, and the end in mind is competent, confident graduates. So that's a different way than the traditional approach to curriculum design. The traditional approach to curriculum design is on inputs. We have this much time and these faculty with this expertise and tradition, so this is how we're going to design our curriculum. And this has been a very, very different process of we don't have the time we're used to or the modality that we're used to, and we can't let everyone kind of experiment with creating things on their own. This has to be, it can't be a patchwork quilt. It has to be a curriculum that holds together. And so we've really been able to take more of that kind of outcomes-based design or competency-based design, and we're already seeing some wins from that. Another example in the fourth year of something that we want to carry forward is much more rapid adoption of competency-based education from an assessment point of view. We have more and more faculty who are signing on to use the entrustable professional activities, or EPAs, that you're familiar with, to kind of design how they're making sure students have the right experiences and how to give students that real-time feedback, coaching feedback, to help them continue to move past competence to proficiency or excellence.
Wonderful. Well, I truly enjoyed the opportunity to have this discussion with you, and I have no doubt that our colleagues that are going through the University of Minnesota College of Veterinary Medicine's program right now are on track, if not perhaps benefiting from some of these adventures, as you called it. So thank you so much. I really appreciate it.
Well, thank you. Thank you so much for joining me today in this conversation and for your fantastic support of the college. You are a wonderful alum amongst many wonderful alums. Thank you.